Our University of Washington transplant team wants you to learn as much as possible about your kidney and pancreas transplant journey. In this video, we will review the basics of kidney transplant, the process for transplant evaluation, what it is like to wait on the UNOS waitlist, and lastly, we will give you an idea of what life after transplant looks like. In addition to this educational video, please also refer to the purple packet of information that was mailed to you by our team. This video, as well as the consent forms in that purple packet, will serve as great resource tools for you throughout your transplant process. This first chapter will serve as an overview of kidney and pancreas transplantation. Let's first talk about why your primary nephrologist has referred you to University of Washington for kidney transplant. Your kidneys play a key role in your overall health. Your kidneys remove waste products and excess fluids from the blood. The kidneys also work hard to balance salts, electrolytes, and other substances in the blood. They help to regulate your blood pressure and also produce red blood cells that carry oxygen throughout your body, which in turn gives you energy. Patients with chronic kidney disease stages 4 and 5, as well as patients in end-stage renal disease on dialysis, may qualify for kidney transplant evaluation. These stages of kidney disease are determined by your kidney function, indicated by the GFR percentage on your labs. On the right side of this slide, you can see the GFR percentages as they correspond to the stage of kidney disease. When kidneys fail, a treatment is needed to replace the functions of your native kidneys. There are two common treatments for end-stage renal disease: dialysis or kidney transplant. While there is no cure for end-stage renal disease, people can live long lives on dialysis or after kidney transplant. Many people prefer kidney transplant as a long-term treatment option because it offers more freedom and a better quality of life than dialysis. Like all medical treatments, transplant may not be appropriate or safe for every patient. The process of kidney transplant evaluation is to determine if kidney transplant is a safe option for you. People with certain characteristics of type 1 diabetes may qualify for simultaneous kidney and pancreas transplant. Let's review what the kidney transplant surgery entails. A kidney transplant is a surgical procedure done to implant a healthy kidney from another person into your body. The kidney may come from a deceased donor or from a living donor. If you are approved to be a recipient for kidney transplant, the transplant surgeon will place the transplanted kidney in your lower abdomen off to one side, behind your hip bone. They will attach the transplanted kidney's vein and artery to your vessels to allow for blood flow to and from the kidney. In most cases, the surgeon will not remove your native kidneys, as leaving them in place does not harm you or the health of the transplanted kidney. On this slide, you will see a brief list of pros and cons of kidney transplant that you should consider. If our transplant team determines that you are a candidate for transplant, the survival rate is improved compared to dialysis. After someone receives a kidney transplant, their overall risk of heart attack and stroke starts to decrease. Many patients also report an increased quality of life given more time for daily activities, work, or travel. There are also fewer diet restrictions after transplant than while on dialysis. Some things to also consider about transplant are that it is a major surgery with potential complications that will be reviewed later in this video. With transplant, you must also take medications every day, many of which have side effects and are expensive, which require ongoing medical insurance to help cover the costs. After transplant, you will still need to continue to follow up with the UW transplant team, as well as with your local nephrologist for ongoing labs and clinic visits. University of Washington Medical Center performed our first kidney transplant in 1968. Our first simultaneous kidney and pancreas transplant was in 1990. As you will see on the next slides, our patient survival rates and transplant survival rates exceed the national averages. The United Network of Organ Sharing, commonly referred to as UNOS, is a private nonprofit agency that works with the federal government to facilitate transplants. When you hear our transplant team say that you are listed or waiting on the wait list, it is the national UNOS waitlist that we are referring to. UNOS holds the database of patients who are eligible for kidney transplant and matches them with compatible donors. Another private nonprofit agency is SRTR, who collects national transplant data from all 250 transplant centers to share outcomes with the public. UWMC has excellent kidney and kidney pancreas outcomes. For example, UW transplant patients are 42% more likely to receive a kidney transplant faster than the national average. This means that you have a higher likelihood of receiving a kidney transplant sooner at UW. The transplanted organ survival rate is also higher at UW than the national average. As you can see at the bottom of this slide, UWMC graft survival is 96.97% at 3 years versus 88.96% as the national average. We encourage you to visit www.srtr.org to compare UWMC to other transplant centers in your area. Our entire team of transplant providers will work with you throughout every step of this process while providing research-based and patient-centered transplant care. Next, let's talk about different types of kidney donors. A kidney used for transplant can come from either a living donor or a deceased donor. Deceased donors are sometimes also called cadaver donors. A living donor may be a family member, friend, or complete stranger. We encourage you to talk to people in your life about your kidney failure and evaluation for kidney transplant. The more people who know your story, the better chance you have of finding a living donor. We know it can be hard to talk about living donation with people around you, and because of this, we encourage your family and friends to advocate for you and reach out to their network of friends, coworkers, and community members on your behalf. There are 2 ways for a potential donor to contact the UW Living Donor Program. Any interested donor should call the donor line at 206-598-3627 to learn more about the donation process. They should also visit uw.donorscreen.org to fill out an online screening survey. Many people waiting for transplant have had success posting the survey website on their social media. The living donor evaluation can start once the transplant team determines that you are an acceptable recipient. The donor evaluation can take between 3 to 6 months to complete. If your living donor is not a compatible match to you, but still interested in donating a kidney, we can proceed with seeking out a swap or paired exchange here at UW. This allows for someone who is not your blood type to still donate and allow you to receive a living donor kidney from another living donor. Let's take a moment to review the benefits and challenges of living donor transplant. After a living donor kidney transplant, both the lifespan of the transplanted kidney and of you, the recipient, are longer than after a deceased donor kidney transplant. A living donor kidney lasts an average of 15 to 20 years, compared to 10 to 13 years for a deceased donor kidney. Challenges of living donor transplant include finding the donor and being patient while you wait for the donor to undergo their evaluation. As with any surgery, there are potential risks to the donor, which they will be made aware of during their evaluation. If you do not have any potential living donors, but are an acceptable recipient for kidney transplant, then you will be actively listed in UNOS for a deceased donor kidney. Waiting for a deceased donor organ can take several years, and we will discuss specifics of waiting time by blood group on later slides. There are several types of deceased donor categories, which will be discussed in detail throughout your clinic visits with the transplant team. All patients listed on the deceased donor waitlist are eligible for kidneys with a KDPI score of less than 85%, donation after cardiac death donors, and donors that have met risk criteria. KDPI is a composite score of the donor characteristics. All of the donors are tested for hepatitis B and C and HIV with very sensitive testing. Chances of infection transmission to the recipient are extremely low if the tests for these viruses are negative. You will only be offered a kidney from donors who have tested negative for these viruses. Proceeding with transplant using a kidney who has met risk criteria will be discussed in detail during your evaluation phase, organ offer period, and transplant admission. Deceased donors who meet risk criteria are those who have known higher risk behaviors that may expose them to these viruses. Risk criteria includes high-risk sexual behaviors in the last 3 months, patients who have injected drugs for non-medical reasons in the last 3 months, if they have been incarcerated for more than 72 hours in the last 3 months, as well as deceased donors where there is little or no medical or social history. Our transplant team considers donors that meet risk criteria to be safe for transplant because of the very sensitive testing that is used. If you have questions about risk criteria donors, please contact your transplant nurse coordinator. At the time of an organ offer, you will also have the opportunity to discuss risk criteria donor questions with a transplant infectious disease provider. In this section, we'll outline what is involved in the evaluation for kidney and pancreas transplant, as well as what waiting on the UNOS waitlist looks like. Your primary nephrologist has referred you to UW to be evaluated for kidney or kidney-pancreas transplant. Once your referral is processed, we will schedule you for an initial transplant nephrology consult. During this 1-hour consult, the transplant nephrologist will obtain medical history and do an assessment to determine if kidney transplant may be a safe treatment option for you. After that initial transplant nephrology consult, if there are no contraindications to proceeding, then your transplant nurse coordinator will contact you to discuss the remainder of items needed for the evaluation. A standard transplant evaluation involves abdominal and vascular imaging, cardiac testing, and labs. Additionally, you will need to see your primary care provider to ensure that you are up to date with all routine cancer screenings like colonoscopy, mammogram, and pap smear. You will also need to see your local dentist so that they can assess your teeth and gums to ensure there are no areas at high risk of infection. It is best to see your dentist as soon as possible so that you can begin any necessary cleanings or treatments right away. We will review your chart and provide a list of recommended pre-transplant vaccinations. In some cases, the transplant nephrologist may also request a specialty consult to provide transplant clearance. A list of all the required pre-transplant testing items will be provided by your nurse coordinator. Once all of the pre-transplant testing is completed and reviewed, you will be scheduled for a transplant team visit, in which you will meet with the surgeon, social worker, dietitian, pharmacist, and nurse coordinator. In some cases, we may also want you to meet with our transplant psychiatrist for evaluation. Please be aware of our post-transplant care plan requirement. You will need to identify people in your life who can provide 24-hour-a-day, 7-day-a-week care for at least 4 to 6 weeks after transplant. This caregiver will also need to provide transportation for you to the clinic and attend these visits in their entirety after transplant surgery. The social worker will assess your care plan to ensure you have a plan in place for who will take care of you after transplant. After your transplant team clinic visits, our multidisciplinary team will determine if you are a candidate or not for transplant. We will inform you if further testing and/or consults are needed to help us determine your candidacy. If you are not a candidate for transplant, we will call you and also notify you by mail with a list of the identified contraindications. At each step in the kidney or pancreas evaluation, we encourage you to communicate updates or questions to your transplant nurse coordinator. The average waiting time on the deceased donor list for a kidney transplant at University of Washington is 3 years. Waiting times may vary between blood groups. In some cases, waiting times may be greater due to sensitization. If you are already on dialysis, your waiting time began on the first day you started dialysis. If you are not yet on dialysis, but have had a GFR of 20 or less, your waiting time starts on the day you are listed. If you are listed for simultaneous kidney and pancreas, you can expect to wait for 3 years on average for all blood groups. We want you to know that for all blood types, it is possible to get an organ offer call anytime you are active on the wait list and eligible for organ offers in UNOS. For example, the average wait time may be 3 years, but it is possible to get called with only 6 months of wait time. This means that you need to be ready and healthy enough for transplant anytime you are on the wait list. In addition to getting labs done for your blood type, we will also do antibody detection to determine your PRA value. Individuals with a high PRA value are often termed sensitized, which indicates that they have been exposed to foreign or non-self proteins and have developed antibodies to them. These antibodies commonly develop following a previous transplant, blood transfusions, or multiple pregnancies. Highly sensitized transplant candidates can wait significantly longer for organ offers because these antibodies make finding a compatible match more challenging. If you are approved by the UW transplant team and are placed on the UNOS waitlist, you have certain responsibilities as a transplant patient. You should maintain as normal life as possible and stay as healthy as possible. You should go to all medical appointments, attend all follow-up appointments or new referrals, as well as take all of your medication as prescribed. You should communicate with your local doctors and our transplant team if you have any questions or concerns regarding your health. If you are on dialysis, you should attend every treatment and stay the full time. The transplant team will monitor your medical adherence and may need to place you on hold on the waitlist if you are non-compliant with your day-to-day health care. You should eat healthy and get as much physical exercise as possible. You will also need to continue to get regular dental exams, as well as avoid all tobacco, nicotine, and marijuana products. You will need to stay up to date with routine cancer screenings. You will also need to come back to UW on an annual basis to meet with the transplant team and update some medical testing to maintain your active status on the wait list. You should maintain your weight, blood pressures, and labs within acceptable limits in order to remain eligible for organ offers. Our transplant team may make specific recommendations for the acceptable limits based on your individual medical needs. Please update your transplant nurse coordinator if any of the items on this slide occur. We need to know if you start dialysis or change dialysis facilities. Please call us if you are hospitalized, have an infection, or develop any open wounds. These are all instances where transplant surgery would not be safe, and you may be placed on a temporary hold on the wait list. In these instances, our team will work with you to optimize your health and get you back active on the wait list. Please also call your nurse coordinator if your contact information, insurance, or post-transplant care plan changes. Please also let us know if you are traveling out of town, will be unreachable by phone, or are ever in a place where you would need to decline an organ offer. While you are waiting on the wait list, it is important to plan ahead for when you get an organ offer call. Think about your transportation and housing plans. Make plans ahead of time for childcare, pet care, and notifying your employer that you will need to take time off work for transplant. After the transplant, you will need to have a thermometer, blood pressure machine, and a weight scale at home. Please obtain these items as soon as possible so that you will have them at the time you're transplanted. Anytime you are active on the waiting list, we will mail you a PRA blood tube kit once every month. You are responsible for having the blood tube filled and mailed back to Bloodworks Northwest. It is necessary to have a fresh PRA kit from you every 30 days in order to run a cross-match between your blood and a potential donor. If we do not receive a kit from you every month, we cannot run a cross-match and you cannot receive organ offers. This slide shows some photos of what the monthly PRA blood tube kit looks like. It comes with a sheet of instructions as well as a prepaid USPS return mailing label. You can get your blood drawn at a local lab or at your dialysis center. The kit must be mailed back to Bloodworks Northwest on the same day that the blood tube kit is filled in order for it to be processed in a timely manner. It is your responsibility to drop the kit off at USPS the day it is filled. Your nurse coordinator will review this process with you at the time in which your status is active on the deceased donor wait list. Next, let's review organ offer notifications and what to expect during the transplant hospital stay. When a kidney or pancreas is available, we will notify you by phone. You must always be available by phone and always be ready to come to the hospital when called. You can be called at any time of day or night, which means you should keep your phone on and near you when you are sleeping and/or at work. Please make sure that you have room in your voicemail box and that you listen to voicemails immediately to return the organ offer call. Please note that organ offer calls do not come from a UW 206 phone number. Buckeye transplant coordinators live and work throughout the U.S. and are directed by UW surgeons to make organ offer calls. It is very important that you do not screen unknown or out-of-state numbers. The Buckeye coordinator will try calling your phone, as well as any emergency contacts that you provide to the transplant team. They will always identify themselves as being from the University of Washington Transplant Program. If you can't be located within an hour, you may be skipped over for that organ offer. When the Buckeye coordinator does get a hold of you, they will do a basic health and infection screening. They will also inform you if you are the primary recipient for the organ or a backup farther down the list. They will then provide you with instructions that include when you should plan to arrive at the UW hospital for transplant surgery. If you are ever in a place or situation where you cannot accept an organ offer and undergo transplant surgery, for example, if you are in the hospital or on vacation, please notify your assigned transplant nurse coordinator. When you arrive to the hospital for kidney or kidney pancreas transplant, you will undergo some pre-op testing, including labs, chest x-ray, EKG, and assessment by the surgeon and transplant nephrologist. Please be aware that if you or the donor organ are not acceptable to proceed, then the planned transplant surgery will be canceled before you go to the operating room. Kidney transplant surgery is typically 3 to 4 hours long, and the hospital stay is usually 3 to 5 days. Simultaneous kidney and pancreas surgery is more extensive and usually takes 5 to 8 hours. The hospital stay for kidney and pancreas transplant is 5 to 7 days. For all transplanted surgeries, we begin administering the immunosuppression through your IV in the operating room before the organ is transplanted. You will have several IVs to also administer fluids and pain medications. A kidney from a living donor may start to make urine immediately. Urine production and overall function of a deceased donor kidney may take longer. In some cases, you may need to continue dialysis for a few days after transplant as a bridge while the deceased donor kidney begins to function. In the operating room, the surgeons will place a Foley catheter in your bladder to accurately measure your urine output. Your IV fluids will be adjusted based on the amount of urine the transplanted kidney is producing. This Foley catheter will stay in place for the entire hospital stay and be removed on the planned day of discharge. On the day of surgery, you and your newly transplanted kidney are closely monitored with frequent vital signs, labs, and an ultrasound. On post-op day 1, the day after surgery, you will get out of bed and go walking in the halls with one of our physical therapists. You will be able to try a general diet and transition to oral pain medications. Throughout the hospital stay, you will receive information about post-transplant care and new medications. There will be one designated education day in the hospital that your caregiver must attend before you discharge. The post-transplant nurse coordinators will arrange this education day with your caregiver to schedule a time during your hospital stay that works well for them. You will be ready to leave the hospital when your vital signs are stable and you can safely walk around, when you can tolerate food and your pain is well controlled. Please note that every person recovers differently after transplant surgery. You will be closely monitored, but should also notify the team if you experience any new or concerning symptoms. Next, we'd like to share with you some potential complications with kidney and/or pancreas transplant. The first is rejection of the transplanted organ. Rejection is what can happen when your body attacks the transplanted kidney or pancreas and negatively impacts the organ's function. As I mentioned earlier, we will start giving you medications that decrease the strength of your own immune system during the surgery. The goal with these medications is to weaken your immune system so that it will not detect that the transplanted kidney is foreign to your body. These medications are sometimes called immunosuppressants or anti-rejection meds. You must take these medications 100% of the time and never miss a dose. Keep in mind that we will perform frequent lab tests to measure the level of the medication in your blood, which may require frequent dose changes as well. Another potential complication after transplant surgery is called delayed graft function, also commonly called a sleepy kidney. The transplant providers will discuss with you if the kidney is slow to function, and if you ever need dialysis for a few days after transplant, it would happen here at UW Hospital, not at your local dialysis facility. A potential complication of transplant that our team will discuss with you throughout your clinic visits is the risk of infection. The anti-rejection medications for transplant will decrease the strength of your immune system, which in turn compromises your body's ability to fight infection. After transplant, it will be important for you to avoid places and situations where you may be exposed to people who are sick. We also ask that you avoid certain foods, like raw or undercooked meat and fish, that pose a high risk of infection. You will be given instructions from the dietitian after your surgery outlining how to prepare your food to reduce the risk of infection. We also want you to be mindful of infection exposure risks while caring for pets, animals on a farm, or while traveling. Please notify your transplant team if you have potentially high-risk environmental exposures, and we can provide further education regarding how you can protect yourself in those scenarios. If you have a family history of diabetes, are over 40 years old, or have a diagnosis of obesity, you are at higher risk of developing post-transplant diabetes. In cases where post-transplant diabetes develops, you may require insulin. You should think about this before transplant and minimize your risk by exercising and eating right. If you currently have a diagnosis of diabetes, please be aware that your insulin needs may increase or decrease after transplant. It is very important to stay up to date with all routine cancer screenings like colonoscopy, mammogram, or pap smear. There is a slight increase in the risk of certain kinds of cancer after transplant, including skin cancer. The only additional cancer screening that we recommend is seeing a dermatologist once a year after transplant for them to perform a skin check. You may have a slightly higher risk of skin cancer, thus we recommend sun protection with sunscreen and hats when you're out in the sun. Like all surgeries, there are complications that can occur as a result of the operation itself. Our transplant surgeons will meet with you in clinic during your evaluation to discuss with you the surgical risks in more detail, some of which are listed on this slide. Many of the pre-transplant evaluation tests that we have you undergo are to determine if you are at risk of developing any of these complications and to create a plan to mitigate those risks. Some of these post-transplant surgical complications could require further evaluation or procedures, which the surgeons will discuss with you. Lastly, let's review what life after transplant will look like and what you can expect as a lifelong transplant patient. The UW transplant team requires extensive follow-up in our clinic after the transplant, so let's first outline expectations after leaving the hospital. Once you are home, it is important to keep the surgical incision clean and dry. You will not be able to submerge the incision in a bath, pool, or hot tub for several weeks. You can take a shower and will be given further incision care instructions during your hospital stay. The stitches or surgical staples will be removed during one of the follow-up clinic visits. You will not be able to drive for 4 to 6 weeks or until the transplant providers tell you it is okay. Your post-transplant caregiver should provide transportation to the hospital for clinic visits and should attend all of your follow-up visits with you. If you live several hours from UW Hospital, we may require that you stay in the Seattle area for the first 4 to 12 weeks after transplant. During your pre-transplant evaluation with the transplant social worker, they will discuss this with you and help you create a plan for where you will stay at the time of transplant. Please be aware that the cost of Seattle area housing is your responsibility and is not covered by University of Washington. After transplant, it is important to avoid any activity or positions that put pressure on the new kidney. You should also not lift any more than 10 pounds for at least 6 weeks after the transplant. Before you leave the hospital, the transplant team will provide you with a logbook to monitor and record your temperature, blood pressure, weight, urine output, and oral intake. You should prepare for transplant by ensuring you have a blood pressure machine, weight scale, and thermometer in your home. You will take the logbook with your vital signs to clinic after the transplant so that the providers can have an idea of how you're recovering outside of the hospital. The UW transplant team will prescribe all of your medications and manage all of your medical care for at least 3 months after your transplant surgery, before we transition your care back to your primary nephrology provider. If you received a pancreas transplant, you will be followed in our clinic for up to 6 months. Once you are started on the medications in the hospital, you will be on them for the rest of your life. Your body will never get used to the transplanted organ, thus you will always require some level of immunosuppression to keep the kidney functioning. You will take your transplant medications at 8 o'clock a.m. and 8 o'clock p.m. every day. 100% adherence to your transplant medications is an absolute must. You should not ever miss a dose and should never run out of your anti-rejection medications. Missing doses of the transplant meds can jeopardize the function of the transplanted kidney. For the first 4 to 8 weeks after transplant, you will need to come to the UW Medical Specialties Clinic for post-transplant visits 2 to 3 days per week. Your appointments will start at 7:30 in the morning for the labs and a blood draw, followed by appointments with the transplant providers. These appointments can last several hours. Your caregiver is required to stay for the entirety of these clinic visits. Over time, as you recover, the frequency of both lab tests and clinic appointments are reduced. After 3 months, you will return to your primary nephrology provider for kidney care. You will continue to have office visits at the UW Transplant Clinic every 3 months for the first year, then annually or as needed after that. You will also require lifelong labs and follow-up clinic visits as a transplant patient. We will continue to follow your progress and stability of the transplanted organ throughout your life. Your labs and clinic visits are to ensure that the transplanted organ is functioning as we expect it to. We can make treatment adjustments and even treat rejection entirely if caught early enough in your lab work. Routine follow-up with your primary nephrologist and the UW transplant team is a long-term requirement as a transplant patient in order to ensure that the transplanted organ can last as long as possible. This video is intended to give you an idea of what to expect as you get started in the transplant process. If you have any questions or concerns about anything discussed in this video, please ask one of our transplant providers in your next clinic visit with our team, or contact your assigned transplant nurse coordinator.